Hello, dear friends. Childlessness is a very big enigma for those who really want a baby after they have had their progress in life and they are married, or they want a baby at that stage of life. Normally, I think it is important to understand that that means there is a population of 8 billion in the world today, which you should know. 8 billion people who are born. Out of that, almost 99% are born by conception into their mother's fallopian tubes. And how does this happen? It happens simply during an act of intercourse that the sperm meets the egg in the fallopian tube of the female, and the first pregnancy that is achieved is in the fallopian tube by forming what is called a zygote and later on an embryo. The embryo then travels down on its own into the womb and then sticks to the wall and then gets blood supply and nutrition from the mother, for which it grows, and at the end of 9 months a big baby is born, almost 2.5 to 3 kgs on an average, to this mother. So this is how normal reproduction takes place for the human beings, and this has happened since ages, since mankind has come onto this world. But if these tubes did not succeed in getting these embryos, so in other words, if these fallopian tubes were damaged in these patients who are infertile due to disease or obstruction, what would happen? The sperm and the egg would not be able to meet, and once they cannot meet, it's impossible to get a child, because we all know that embryos develop only when the sperm and the egg meet. So that's a fundamental issue. And therefore, for tubal factor, lot of things were tried, and later on it was found that these patients will definitely need, even the tubes are badly damaged, they will need to have this called in vitro fertilization. Means the tubes will have to be bypassed, and the sperm and the egg will have to be actually fertilized outside the human body, and in an incubator the embryo will be allowed to grow with the advancing technology. Fallopian tubes are amenable to repair also and reconstruction. I am happy to tell you that we deal with both kinds of patients, and we give the patients maximum chance to conceive naturally by giving reproductive microsurgery at its highest level for earlier kind of tubal problems. But later on, if the tubes are grossly damaged, then we would also advocate not to undergo surgery and proceed for IVF or in vitro fertilization. So this is in clarity and explanation where you should go for IVF. One doesn't have to jump for IVF. IVF is a very, very hyped technology, and it is also largely industrially driven. I am an ethically conscious doctor, so I will definitely tell you that it is important that as long as you try for at least 2 years, once you want a baby by natural means, it is only then, and if there is no pregnancy thereafter, you should get investigated and meet the right kind of doctors and the right kind of hospitals to see that you have the best option available, which is also in your economic means, because these technologies can be very, very expensive, and therefore you have to find out the solution with the right kind of consultation. And I'm very proud to tell you all that we have this kind of scenario at our institution, at Gujarat Institute of Reproductive Medicine, which is New Birth IVF, having 2 hospitals, Shelat Hospital and SHREENANDAN Hospital at Surat.